I have to start the recording on my end, na?
If we are on YouTube, you do not need to record.
Okay.
Because
Then we will
now
be having.
we are live on YouTube, so I will give you the link. So it will be recorded only.
Okay. So I don't have to record anything.
Yeah. Now we are live.
We are not able to see here the delegate join, na?
No, no. So you can start, sir.
Make me host.
You are host now.
Yeah. Okay. Yeah. Good evening, sir.
Good evening.
Good evening.
PC Mahapatra, sir. Good evening. Welcome.
Good evening, sir.
Bhaskar
Sir,
Pal,
good evening.
Good evening. Welcome.
I'm going from Hosur to Tumkur.
Oh. Yes, sir.
Shall we start? Yes, good evening, all.
Good evening.
Yes.
Good
On
evening.
behalf of AMOGS Sexual Medicine Committee, myself, Dr. Madan Kamble, chairperson of the committee, I'm feeling honored to welcome you all for this wonderful and special webinar arranged by the committee, and which is sexual health for all. This is the third episode of this sexual health series. With the blessings of AMOGS office bearers, President AMOGS Dr. Kiran Kurtkoti sir, Secretary Dr. Bipin Pandit sir, Vice President Dr. Amay Purandare sir, Dr. Bharti Abgankar madam, and all the executive members of AMOGS. I welcome, and along with my co-convener Dr. Vaidehi Thakur from Mumbai, who is committee member. Today we are so lucky to have esteemed dignitaries and guests. Chief guest, our respected Dr. PC Mahapatra sir, and guest of honors, Dr. Bhaskar Pal sir, Dr. Sneha Bhoyar madam, Dr. Meenu Agarwal madam, Dr. Preeti Kumar, and Dr. Amay Purandare sir, who is the vice president, senior vice president, AMOGS. And today's esteemed faculties we have got is Dr. Rajshekhar Brahmbhatta sir, who is one of the senior most sexual health expert from India, and Dr. TSS Rao sir. We all know him. He is the senior person and most wanted and respectful person, and he is the expert in the field of psychiatry and sexual health from the South India. We all know sexual health is an integral part of overall health and well-being. Ensuring people can have pleasurable and safe sexual experiences, which should be free of coercion, discrimination, and health risk. We all are doing a fantastic job to spread the awareness regarding the sexual health amongst all the medical fraternity and our society. It's our duty and responsibility to do it, and we are trying through the platform of AMOGS and FOXY. FOXY is the largest organization of OBGYN in the world. Just a minute. Yeah, I will share my screen now. Yes, I hand over to my co-convener, Dr. Vaidehi, for the inaugural. Over to you, Dr. Vaidehi. You are muted.
Good evening to all of you. First of all,
Yes.
So
Yes.
I start this session with the beautiful Nivedan which we have today. सदर ध्वनिचित्र फित ही महाराष्ट्र स्त्री आरोग्य आणि प्रसूतीशास्त्र संघटना यांनी केली असून याचा कुठलाही व्यावसायिक उद्देश नाही. या ध्वनिचित्र फितीमध्ये वापरण्यात आलेले महाराष्ट्राचे प्रतिनिधित्व करण्यात आलेले असून ते साभार YouTube वरून घेण्यात आलेले आहेत आणि AMOGS सदस्यांचे शूटिंग संस्थेने केले आहे. सो इट इज जस्ट a small shot of what we'll be having for today's light.
Yeah,
So
this is the official AMOGS song.
Yes.
जय जय महाराष्ट्र माझा, गरजा महाराष्ट्र माझा. जय जय महाराष्ट्र माझा, गरजा महाराष्ट्र माझा. जय जय महाराष्ट्र माझा, गरजा महाराष्ट्र माझा. रेवा वरदा कृष्ण कोयना भद्रा गोदावरी. रेवा वरदा कृष्ण कोयना भद्रा गोदावरी. एकपणाचे भरती पाणी मातीच्या घागरी. एकपणाचे भरती पाणी मातीच्या घागरी. भीमथडीच्या तट्टानाळा, भीमथडीच्या तट्टानाळा यमुनेचे पाणी पाजा. महाराष्ट्र माझा, जय महाराष्ट्र माझा, गरजा महाराष्ट्र माझा. भीतीन आम्हा तुझी मुळी ही गडगडणाऱ्या नभा. भीतीन आम्हा तुझी मुळी ही गडगडणाऱ्या नभा. आसमानाच्या सुलतानीला जबाब देती जिभा. आसमानाच्या सुलतानीला जबाब देती जिभा. सह्याद्रीचा सिंह गरजतो, सह्याद्रीचा सिंह गरजतो शिवशंभू राजा. दरी दरीतून नाद गुंजला महाराष्ट्र माझा. जय महाराष्ट्र माझा, गरजा महाराष्ट्र माझा. जय महाराष्ट्र माझा, गरजा महाराष्ट्र माझा. जय महाराष्ट्र माझा.
So with this beautiful song, Now I request my colleague Dr. Madan Kamble sir to introduce to our chief guest Dr. Mahapatra sir.
We will have a lamplight. It's my honor and privilege to welcome today's chief guest, none other than Dr. P.C. Mahapatra sir. Apart from his CV, actually, I would like to say some few words. He is a great human being, great academician, and inspiration to all Foxians. We are really overwhelmed when sir accepted my invitation from a small society like Aklus, and he came to for my conference Barkha at Solapur. Literally, my society was totally overwhelmed and in shock. Sir has come to Solapur. We enjoyed and really I'm very thankful for sir. He's a great academician and past president of Foxy. He was the ex-professor, head of the department at SCB Medical College, Cuttack. He was Foxy representative to Suffolk, past vice president, life member of IMA. He has so many awards, the Lifetime Achievement Awards, and he's a great teacher. And he's a founder of Prachi Institute for Mother and Child Care. And most important thing is he's working for poor and needy people of Odisha. That is very appreciable thing. And I'm so thankful to sir. You have accepted the invitation and attended today our event. Over to you, sir. We need your blessings.
Thank you, Madan, for overestimating me and emotionally blackmailing me to this episode of Sexual Health organized by the AMOGS, a vibrant organization in the country. Well, I'm so delighted to be associated with this particular episode, and I express my heartfelt thanks to all the organizers and office bearers of the AMOGS, and especially to Kiran and Bipin and all the advisors as well as the executive body members of this vibrant organization AMOGS, and you, the organizers who have started this webinar, and all the viewers watching this particular episode. I think sexual medicine is really a subject which has not been focused much earlier. I remember when I was the president of Foxy, I thought of starting a different committee on sexual health, and that's beginning of the sexual health committee. Though I was involved in the sexual medicine of All India Federation, where legendary sexual health experts were also involved in that. In this particular session, I think I again welcome all of you. I welcome and congratulate the 5 guests of honor and 2 very dynamic as well as handsome personalities, Vaskar Pal and Amiya Purandare, and brain with beauty, Priti, Sneha and Minu, who have joined this particular as a guest of honor for that. From the core of my heart, I express my deep sense of gratitude to them. And last but not the least, about the episode, about the subject A to Z of female sexual health. I think 2 great experts have come, Rajsekhar Brahmavat sir and Dr. T.S.S. Rao. I know time will not permit me to extend my lecture particularly. I can give lecture on Brahmavat and T.S.S. Rao. And they're so famous. I consider them as the father of sexual medicine in the country. And I'm so close to them that yes, today, when I knew that Brahmavat sir is coming, I thought the particular session will be really overwhelming and an amazing session for that. and I consider them as a father of sexual medicine in the country. And T.S.S. Rao has totally dedicated himself. He is also legendary in the field of sexual medicine, and therefore we're eagerly waiting to listen from them A to Z of female sexual dysfunction. I think this is absolutely essential. All gynecologists must admit that females do not express from the history, but when you inquire about the history, they are really very much enthusiastic in telling about the details of the sexual health for that. And particularly in the field of infertility, as well as in other fields also, this female sexual health is really a concern for us. And I think a lot of information will gain it. And in day-to-day practice, every clinician and gynecologist will really learn a lot from this episode. Thank you, Madan, again, for giving me this opportunity to be associated with this particular fantastic, extraordinary webinar. And the subject is really interesting for that. And thank you very much.
Thank you so much, sir, for coming and blessing us. Thank you so much, sir.
Thank you.
Yeah. Yeah. Over to you, Dr. Vaidehi, to welcome the
I
guest.
have the pleasure to introduce to our guest of honors. So we have with us Dr. Amay Purandare, sir, who needs no introduction, sir. So welcome, Purandare, sir. He is, as we all know, again, he needs no introduction, but just to mention, he is consultant obstetrician gynecologist at Purandare Hospital and KJ Somaiya Medical College. He is senior vice president AMOGS 24 to 26 and joint secretary. He was the joint secretary FOXI 2019. He was also the assistant administrator FOXI Manyata project on quality care in safe childbirth, and he is the member of managing committee and mentor for Youth Council MOGS. So then we have next guest of honor.
No. Over to Amay, sir. Amay, sir, is there.
Over to Amay, sir.
Good evening, everybody. It feels a great sense of honor and pride and privilege to be guest of honor for this webinar. The reason I'm saying, because this seems to be a legendary webinar. We have three legends here, truly the legends of sexual health in our country, Dr. Brahma Bhatt and Dr. Rao, and none other than the legendary gynecologist from India, Dr. P.C. Mahapatra, sir. More importantly, we have the true friends of AMOGS in the form of Dr. Bhaskar Pal. Dr. Bhaskar Pal, lots of best wishes and warm regards from all the AMOGsians, and I hope all your dreams to take FOXI to higher levels along with AMOGS will come through in your earnest endeavors. Dr. Preeti Kumar, who I call Stree Power, is also here. And I wish Dr. Preeti Kumar, who is also a true friend of AMOGS, all the best for her endeavors as well. Dr. Sneha Buyar, what can I say? She is a true AMOGsian at heart, 100% AMOGsian, and very hardworking person. And I wish Sneha ma'am all the best for all your endeavors as well. Madan and Vaidehi, congratulations on putting forward this web series, which I think is extremely important and often overlooked in the super specialization fields that are taking the limelight in our conferences. So I think this is a very important thing. Last but not the least, I am really happy that AMOGS is spreading its wings far and wide. We are truly not just a regional organization, but with the digital platform now, we are going definitely national and even international. So once again, congratulations. It's truly, I feel blessed to be amongst the legends today. PC sir, who is a true friend of AMOGS. I've seen him at AMOGS conferences right from the time I joined AMOGS. And also Dr. Brahma Bhatt, whom I closely associate with the Family Planning Association, and Dr. Rao. So once again, thank you very much, and all the best to all my colleagues who are putting all their hard work in their FOXI elections. Thank you.
So thank you, sir, for blessing the occasion. Now,
Thank you, sir.
so our next guest of honor is Dr. Bhaskar Pal, sir. Again, one more legend amongst all the legends. He is a senior consultant gynecologist at Apollo Multispeciality Hospital, Kolkata. He is chairperson AICC RCOG and he's chairing endoscopy committee CEFOC. He was the immediate past president of IH and FOXY representative to CEFOC 2021 and 23. He was the chair organizing committee AICG 23 Kolkata, which was again a very heat program.
Good.
Over to you, Bhaskar Pal, sir.
Thank you. Thank you, Vaidhi, for the kind introduction. And thank you, Madan, for inviting me. Madan is like a younger brother to me. And I take this opportunity to thank the AMOGS office bearers, Dr. Kiran Kurtakoti, President, Dr. Ameya Purandare, the young Senior Vice President, Dr. Bharti Abhayankar, and Dr. Bipin Pandit. Ameya, thank you for your kind words. I think everything has already been said. It's a pleasure to be among friends and seniors. And especially to see Dr. P.C. Mahapatra here. Dr. P.C. Mahapatra is Dronacharya, and he's got thousands of Ekalavyas all around the country, and I'm one of them. And also pleasure to have my good friends, Dr. Preeti Kumar, Dr. Sneha Bhuyar, and Dr. Minu Agarwal here. And congratulations, Madan, for a wonderful program. Yes, we need to speak more about female sexual dysfunction, but you've got two stalwarts in the field to speak today, Dr. Raj Brahmabhat and Dr. T.S.S. Rao. And I'm sure that this is going to be a very exciting program. I'm deeply honored for you having me here, and I wish you all the best. Thank you.
Thank you, sir. Thank you so much.
Thank you, sir, for coming. You are a great human being, orator, great planner, and great organizer. And you are the right candidate for president. And I wish you all the best.
Thank you.
So, our next guest of honor is Dr. Sneha Bhuyar, ma'am. Welcome, ma'am. She is the candidate for Vice President FOXY West Zone. She is the international MS signature. She won the International MS Signature Award for Phenomenal Leadership in 2020 and Asia GCC Award 2021, and many such awards are there to her credit. Presently, she is the FOXY Breast Committee Chairperson. She was the FOXY Breast Committee Chairperson in 19 to 21. GCM ICOG 21-22, National Adolescent Trainer at WHO FPI Certified Program, then National Expert at UNICEF and Peer Reviewer of Jogi, and many such to her credit.
Thank you, Dr. Vaidehi. Thank you. I think that everybody knows here me, and of course, I wish a very good evening to all of you. My respect and regards to respected Dr. P.C. Mahapatra sir, who is the chief guest for today's program, Dr. Raj Brahmabhatta sir, whom I know personally, and of course, Dr. T.S.S. Rao. My respect and regards to all three of you. It's a proud feeling sharing diets with Dr. Bhaskar Pal, Dr. Ameya Purandare, and of course, our dear friends, Dr. Preeti and Dr. Minu. Of course, you have put together a very important and much needed topics and the program, Dr. Madan. So hearty congratulations to both of you, Madan and Vaidehi. Once again, I thank the entire team of AMOGS Sexual Medicine Committee, and of course the AMOGS office bearers. Dr. Kiran, he's in US at present, but yes, Dr. Bipin Pandit and the entire team of AMOGS. And I would like to thank everyone here for having me here. Thank you so much for all your blessings and best wishes to me. Thank you.
Yeah, would like to say something about Sneha ma'am. She is so hardworking, sincere, and dedicated person, and she is the icon of AMOGS and FOXY too. She is working so hard. So we wish you for the upcoming elections, and I appeal all to support you.
Thank you so much, Madam. Thank you. Thank you for your special words of appreciation. Thank you so much.
Yeah.
Thank you so much, ma'am. So, do we? Ma'am has joined. Minu ma'am, are you there?
I'm not able to see.
Yeah.
ठीक है. Dr. Meenu ma'am is the past president of FOXY and she was past chairperson of Imaging Science Committee, and she is contesting for vice president elections of FOXY. We wish ma'am all the best for this. I think she is busy in another webinar, so couldn't join.
Even I think Preeti ma'am.
Dr. Preeti Kumar, she is also not there.
Yeah, Dr. Preeti Kumar is traveling from Nasik to
Yeah.
Bangalore. So
Yeah, she is busy in some other program. Okay. Wish her all the best for the upcoming elections too. Yeah. And thank you. Yes, all the guests of honors, Dr. Bhaskar Pal sir, Sneha Boyar madam, Dr. Amay Purandare sir, Meenu ma'am, Preeti ma'am. Thank you for coming and joining today's event and blessing us. Thank you once again. And thank you, PC Mahapatra sir, for coming as a chief guest and blessing the AMOGS activity. Thank you, sir. Yeah.
Thank you.
Yeah. Thank you, sir. Yeah. Sir, we will move on to our academic session. The topic of today's discussion is A to Z about the female sexual dysfunctions. And we have got the esteemed faculties, very well-known faculties from India, Dr. Rajshekhar Brahmbhatt sir and Dr. T.S.S. Rao sir. Both are legends in the field of sexual health. I would like to introduce Dr. Raj Brahmbhatt sir. He's the godfather in the field of sexology. We all know about his biodata. Then he's the founder and trustee and emeritus of CSEPI. Also, he's the director of Kama Institute of Sexual Studies. He has achieved so many lifetime achievement awards like Golden Lamp Award and L.P. Kriplani Lifetime Achievement Awards. Also, he has done the exhibition called Erotica in the 7th World Congress of Sexology in India. He has conducted so many workshops in India and also outside Nepal, Bangladesh, Sri Lanka. He has so many hobbies like photography, literature, travel, etc. And he is practicing since more than 42 years. That is so much appreciable. And sir never says no to me whenever I call sir. Sir immediately picks up call and advise me anything what I want. Thank you, sir, for every time you're coming for AMOGS and FOXY programs. Thank you, sir. And Dr. T.S.S. Rao, sir, he's always in my program also, in FOXY program also. He always accepts our invitation. Thank you, sir, for that. Sir is the professor in Department of Psychiatry, JSS Medical College, Mysore. He was immediate past president, past general secretary of Indian Psychiatry Society. Also editor, Journal of Psychosexual Health, former president of Indian Association for Geriatric and Mental Health. Also former editor, Indian Journal of Psychiatry. He has so many publications, books and book chapters, orations, and also he is the president of Karnataka Sexual Sciences Academy. I welcome both the faculties today, and over to Dr. Vaidhi to start the session.
So welcome to our most esteemed speakers. So without wasting much of time, let us start with the academic part of this session. So the question to both the speakers is, sir, what is your idea of sexual health and why it should be a matter of concern in today's life?
Good evening. Before I start, let me wish all of you, AMOGS and FOXY people and those who have joined. ये सावन का मौसम है, बारिश आ रही है, रिमझिम रिमझिम, शाम का वक्त है और इस वक्त या तो कांदा भजी अच्छी लगती है या सेक्स की बात अच्छी लगती है. And if I think of कालिदास, आषाढ़स्य प्रथम दिवसे, तो मेघदूत को अपनी यक्षी याद आती है और मैसेज भेजता है. तो आज आषाढ़ का दिन है, मुंबई में है हम, पूर्ण चंद्र खिला हुआ है, डॉक्टर पीसी महापात्र, जिनको हम पहली दफा 20 साल पहले मिले, तब से आई एम इन लव एंड आई ओ हिम अ ग्रेट, सेकंड इज, कामदेव ने मुझे बोला कि आज आपको, पहले तो बोला A to XX पे बोलना है, आई सेड A to Z कर दो, तो A to Z पे बोलना है। और मैं बोला बारिश में और ये सेक्स में मैं तो बिक जाऊंगा, तो बोला डोंट वरी, और वैदेही इज देयर, she is a navy person and she'll take you out and she'll swim and take you out of it. And last but not least, when I was told that why do you worry, sir, you have got a total sex solution with you, and Dr. TSS Rao, he knows it and he will agree with me, he is my Manas Putra. We have been working for last 30 years together, and he has taken to another height as far as sexual medicine is concerned. And any father who is proud of his son, or any guru who is a son proud of his chela, I think he is more than me. He is one person who could have taken care. So let's begin. We start with Kamadevaya Namaha. Or I remember last week I was in Delhi in a longevity conference. And there, Dr. Suresh Jindal from Meerut, he asked me, he said, I want 1 minute bite from you. I said, go ahead. He said, agar sex na hota to kya hota? I said, agar sex na hota to tum bhi na hote, मैं भी ना होता। और एज पर द गायनेकोलॉजिस्ट आर कंसर्न, अगर सेक्स नहीं होता तो आप सब, मुझे लगता है कि कोल्हापुर महालक्ष्मी के मंदिर में या शिरडी में या सिद्धि विनायक में या त्र्यंबकेश्वर में बैठे होके। तो फॉर अस इट इज वेरी वेरी इंपॉर्टेंट। नाउ व्हाट इज सेक्सुअल हेल्थ? Really speaking, WHO started very late, in 1975. They said first was a physical health, mental health, but sexual health came last because it's a taboo. And let me tell you, I respect Dr. Freud, Masters and Johnson, Kinsey, Helen Kaplan, and John Bancroft. And if I think of our country, can you believe 3 centuries back, Vatsayana, who wrote Kama Sutra? And you can imagine that all over the world, if you see, there is not a single book which you will find which is written on a Kama Sutra. And last not 40 to 44 years, I have been talking on Kama Sutra, and every time I go, I find something very different and new. And what in Kama Sutra, Vatsayana says, now WHO defines a state of physical, emotional, mental, and social well-being in relation to sexuality. While in Kama Sutra, if you read what Vatsayana says, a physician without the knowledge of herbs, an accountant without the knowledge of figures, and a married man without the knowledge of sex are all useless creatures. So sexual health is very, very important. We have taken all around the world. In 1985, when I did an exhibition, Erotica, you'll be surprised to know in Delhi, right from Vedic period till the Britishers period, till they came, sex was never a taboo in our subject. And there was a 35 books I found on the subject of sexual medicine. Over to you.
For me?
Yes.
Would you like to add something to this, sir?
Good
Rao,
evening, and at the outset, let me thank Dr. Madan and people involved in the program. This is an extraordinary opportunity that has been given to me, and I'm really very happy that I am sharing the screen with Winter of Brahmabhat. And it is a long journey. My first meeting with him was in Mumbai in Hotel Diplomat almost about 3 decades ago. And this particular friendship has grown. Coming to sexual health, why it is important. I won't go into the details Dr. Brahmabhat has mentioned. The important point here is, whenever somebody uses the word sex, invariably we think of something about intercourse or purely physical and something what actually happens in the four walls. But it is much beyond. It is individual's personality, it is individual's worth, his friendships, his association, among all those things, even reproductive and actually the sex come into the picture. So it is something very, very broad one. And among all the quality of life parameters, if somebody is talking about, this comes as one of the topmost aspect. Overall, this is one of the most neglected area. This is one what actually I can understand very comfortably. Almost about 3 centuries or 4 centuries, whatever, Vatsayana's Kama Sutra to today, if you try to look at, India has moved quite forward. For the simple reason, at least in the last year or two, what I am seeing, so many programs through either Foxy or AMOGS, and not only this, and not many other associations. And Indian Psychiatric Society, we put up a lot of effort to see that a special branch come up, and the specialty section on sexual medicine formed almost about 1.5 decades ago. The issue here is this is neglected. Only just I'll mention 2 words only. I was recently in Abu Dhabi, and the government recommended that this particular lecture should not be done. So my lecture was cancelled, not because of anything, that word sexuality was there. I still remember Indonesia, we had conducted 1.5 days program, and the 3rd day, government realized that some program is going on sexuality. They told this program needs a special permission from the government, and from that angle, it was stopped. So compared to that, remarkable changes are happening in the country, and I think great kudos to many of the organizers, and particularly this particular program. I'm really grateful that this has actually happened. And only another one last word. Why this particular program, 2 males are taking part for female sexuality? Of course, there could be some bias in responses what we are going to give, but let me just say that we'll purely confine to something related to the science what we understand. All said and done, there could be some bias. As a husband, I have my own issues. As a father, in fact, I am closely watching how my daughter is progressing, issues related to that. I was the son to my mother, and a lot of colleagues and the people whom you have met, each one has contributed to understand certain things. So what one can say is there are few general statements definitely one can make. Almost always, whatever we may be telling, there may be exception that we should be well aware of. So in gist, whether we are talking about man or woman or any individual, married or unmarried, sex is there, part of it. And I always go another one step ahead, and I will say, every person you meet on this earth, they have sexual problem cases. Only question is yesterday, today, or tomorrow. You got the point? So this is part and parcel of our being, and we definitely need to look into it in an passionate way and try to understand it. Extremely important aspect. Thank you.
So, thank you, sir. You gave the very important aspect of how the approach is there outside India as well as in India, and I think we are progressing to a much better way, and our views are getting broadened with this sexual medicine. So, with this introductory question, now as we know, the female sexual disorders, they have got multiple varieties, and it is now recently classified. So my next question to our speakers is, what are the types of female sexual disorders?
Okay.
I just want to know the new classification for this.
Okay. Now, can you see me in the full frame? Because
Yes.
I am not seeing myself in a full frame.
Sir, you pin it. Once
Okay.
you pin it, you will be there in the full
Where
frame.
is the pin? Where is the pin? I have no idea.
With the 3 dots,
No.
the top right corner.
Okay, that is the
Now
upper.
you are full screen.
Now I am full screen, right? Right.
Yeah.
Now I am seeing you.
Yes, you are full screen.
I am being seen, but I am not seeing myself. I am not seeing myself.
You have to pin to come to the main frame. You have to pin yourself.
Where exactly? 3 colors. Left
Okay,
side.
I am the host now. I can do that.
Okay,
Pin.
please.
Okay.
Actually, I have pinned.
I have done it.
No, I am not seeing.
Sir, sir, one just request, just go on your pic.
No, I have pinned.
Go on your.
Sir is.
I am seeing you as a full screen.
Sir is on full screen, no?
You are seeing me as a full screen?
Yes.
Yeah.
But I am
Yes,
not
sir.
seeing you. I am not seeing myself.
Okay, but we are able to see on full screen.
Okay.
We're all seeing you as a.
Sir has to click on the right upper corner of his video on the
There are
screen.
You,
three
where
dots
you,
are there. Three dots.
where
three
you
dots are
see
there,
three
view.
dots.
Okay.
Click on the three
Speaker
dots.
and then speaker.
And then you get two options, chat and pin. So you click on pin.
Chart and pin.
There
Now,
are
Your video,
okay.
right upper corner, you get three dots, blue color.
Blue. No, I don't see anything, because
You take your cursor at the right upper corner.
right upper corner view is there.
Yes.
No, I am seeing Dr. Sneha Bhuyer, AMOGS chairperson.
You can take it on your right or left. Maybe it will be opposite for you.
Okay, and now I'm able to see the pin.
Yes, now you click on that.
Right. Thank you very much.
Yeah.
I'm a little narcissist. I wanted to see my face. Okay. So coming back to before I start, Satya, I would like to say, because we are too male, but I always say that when I sit in the chair of a sexologist, I have no gender. It is much more difficult than any dharma guru, to be honest with you. So we have no gender. Whatever we have learned, we are going to share with our people. Now, as far as all of you are concerned, when we talk about the types of female sexual dysfunction, I would request all of you to go and study in detail Masters and Johnson, male and the female sexual response. That will help you in a lot many ways. He had missed out desire phase, which was added by Helen Kaplan. Then Besson Rosemary came, and she has given emotional aspect, and she has given a real picture what female are feeling it. And there is one more Reed's, way of doing it. Now, previously, I still follow Masters and Johnson's, that is desire, arousal, lubrication, penetration, orgasm, and pain. While recently, I think Dr. Rao will be more able to tell you that they have clubbed two. One is a interest and arousal disorders, and second is a pain and pelvic disorders. And as far as the other things are concerned, I would say you must remember John Bancroft. What he said, that man conceptualizes his sex around the genital area, while female, they are in terms of the relationship. So we are not treating, whenever the client comes, either the male problem or a female problem. What we are treating is a relationship. Over to you, Satya.
Okay. See, earlier, the sexual problems were there in psychiatry section. Chapter 5 used to deal with psychiatric disorders. Sexual problems used to be there. Let me just take about a minute or two extra to go into the history and come to currently what actually is the situation. See, if you look at ICD-10, which was in vogue for almost about 1.5 decades, all disorders which are organic used to go to that separate section actually. And those which are actually not having organic problem, they used to be covered under sexuality section. I'll just quote one single word, lack of sexual, what we call as response. So this type of very general terminologies, one actually was not able to make out certain things. And the categorization that purely something is psychological and something organic, no more tenable. Combination, all of this. Of course, the second, there may be a lot of young people who will be listening to this lecture. Whenever we say sexual dysfunctions, we are talking about problems in sexual response cycle. Earlier, what Master Johnson mentioned, let us, in fact, we have moved quite forward. And now we talk about desire, arousal, orgasm, and resolution. And when you are trying to talk about female sexuality, for example, David Reed speaks about quite a few other terminologies, quite romantically, actually, the explanation. Let me just talk about it a little later if any other person asks the question. So ICD-10 was really hopeless in the sense that we were not able to clearly delineate syndromes, and etiologically speaking, it was actually a little problematic. DSM-4, American Psychiatric Association, which came about, there was a division about organic, psychological, plus other this thing. Let us not go in too many into the detail, but it was definitely better than ICD-10. DSM-5 when it came, now female sexual, for example, sexual response cycle, if you are trying to talk about, both male and female, lot of changes have happened. I don't know how much I should speak on male issue. Coming to the female, say for example, earlier classifications used to have, there is something called as a desire disorder, there could be problem. But when we are trying to talk about female sexuality, it is almost impossible to know which is actually desire component, which is actually the arousal component. In fact, sometimes it's difficult to understand women. Sometimes we men are frequent in talking about it. Even when it comes to sex, even when it comes to the science of sex, there was actually confusion how to go about. This particular confusion was never resolved, and one of the compromise decision was made was one technical term, interest and arousal disorders, female sexual interest and arousal, wherein both desire and actually what we basically call arousal components have been brought together. So now there is no place like hypoactive sexual desire disorder, which is there in case of a male, in case of female sexuality is concerned. Of course, other headings almost always, not almost always, they are there. Hypersexuality is one of the very commonly emphasized terminology in earlier classifications. If you look at ICD-10, both in case of man and in case of woman, that means there is something, inverted comma, increase. What is that increase and all we may not be aware of actually. Now those things have been knocked off. It is not there. The major classification talks about sexual response related disorders, and other one is actually pain and penetration related disorders. Both the things, like what we call dyspareunia earlier, what we used to talk about, vaginismus, what we used to talk about, again, differentiation. In fact, there are so much of literature has happened, there is almost impossible to say that purely organic and purely psychological, not possible that way. So a biopsychosocial model, what is actually important. So both the things have been combined together. Now actually we have to have is this pain and penetration disorder. There used to be, whenever we are talking about desire disorder, sexual aversion disorder. See, many of the times when we have gone to some of the programs conducted by OG societies, urologists, endocrinologists, and others, there used to be invariably a lot of confusion related to the sexual aversion disorder. What sexual aversion disorder means? There is a phobic type of reaction to anything sexual. In fact, a whole lot of work went into the research and review related to this, and now this particular section has been taken totally off from sexual dysfunctions, and now it has been placed under phobia because there is actually fear, there is actually avoidance, it meets all the criterions, and so it has been put in there. So these are the few things that have actually happened as far as the female sexuality is concerned. So if you are trying to talk about dysfunctions or inadequacies, it actually based on sexual response cycle. Second one, the phases what we used to talk about earlier, some of these things have been combined together and it has been reached. The hypersexuality section has been totally knocked off in both the sections because we really don't know. And this is actually primarily speaks like in terms of derogatory connotation. So this is one of the idea. One more last point what I would tell at this particular point is earlier sexual disorders used to be covered under psychiatry section. Now there is a special category altogether for sexual disorders. Again, reasons are many. Take an example for a gynecologist to talk about a disorder which is described, dealt under psychiatry, almost always some amount of hesitation. And a lot of research started coming from dermatology, urology, endocrinology, gynecology. So if a separate category is given, research can happen, understanding can improve, and a whole lot of issues can be dealt comfortably by everybody. This is the idea with which actually the ICD-11 has removed psychiatry section, in fact, sexuality section from psychiatry, and it has been brought to the one of these separate category. One can speak on quite a bit, but now the basic premise what we have is there are sexual dysfunctions, and among them sexual response cycle related disorders, and those which actually related to the functionality related to the intercourse, the pain and the penetration related disorders. That means two major categories. There are a lot of subheadings are there, and as questions come, we'll try to elaborate.
So thank you, sir. You both the speakers gave us a very brief idea about the classification of female sexual disorders. So over to you, Madan sir, to the next question, sir.
Yeah. As we all know, there are so many risk factors for female sexual dysfunctions, like depression, anxiety. There are many times there are cardiovascular diseases or some neurological conditions, some gynecological conditions, especially vulvovaginal atrophy, infections, like lichen sclerosis, vulvodynia, and some medications are also responsible, antidepressants, antihypertensives, etc., and some emotional and psychological factors too. I would like to know if a couple comes in our OPD and one of the partner is having some sexual disorder, does it will affect the another the partner or his spouse? I mean, how it affects?
So before you say, what you said very nicely, you covered the risk factor. And you also gave first psychological problem, then organic problem. But one factor which you forgot, which Dr. Rao has said, always keep these three things in the mind. First of all, it was taught everything is psychogenic. Then, today the pendulum has moved to other side in 80% of the cases. We are able to find some organic causes. Now, it does not mean that it is either purely psychological or purely organic. It is always a mix. There is always some color from here to there. And lastly, I would request all of you to give a more focus on a social aspect, bio-psychosocial. So unless in terms of social things, I think you will be missing a majority of the problems. And you will have to be like I would say, Sherlock Holmes or a detective. Whenever somebody comes in, you try to see at what group they are there. You will come with some treating symptoms again and again. They will come to your clinic. They do not have any courage to say that we have a section. So adolescence will be the first one. Then you come down to around the marriage age. Then there are some serious illnesses, as you said, operations and drugs. So all those factors you should keep it in the mind. Now coming to say that if one person has a problem, do you think that it's the other person, is responsible, or how it affects the disorder in other things? Now imagine a case of vaginismus. Now she has a fear, she has anxiety, she will be very tight, she won't be allowing the entry of the penis inside. Now the first time when the man is trying to go inside and he's not able to do it, and his erection will go down. What he will think, there's definitely something wrong. Or some of the friends that said that don't do masturbation. He will be, namard ho jayenge, and he will start thinking that yes, there is a problem. And that will create a frustration. Second time he will try to go there, is the performance anxiety, fear of failure, and also he is doing the spectator's role. Again he will fail, and a vicious cycle will be there. So here the female creating the problem. Now in case of a male, with the premature ejaculation or erectile dysfunction, it will create a lot of problem in the partner. And recently I am treating one case where he is a premature ejaculator. He has never satisfied the wife. Wife have now gone into extramarital relationship, which has been caught over the digital things. So it is always there. In case of infertility, I think both are very important. The moment you try to find it out that the semen analysis is done and there is azoospermia, the other person starts saying making other person guilty. So there is either the female problem, male problem, or there can be a combined problem. I remember very early case. Dr. Rama Vaidya, one of the towering personalities, he had sent me a case and I was about to go abroad. And the young person who got married, they were staying near a 5-star hotel, and he was not able to perform. So she has examined the female and they said she is fine. Just try to examine the male and let me see. When I went to the male, went into detail, he had a number of encounters in USA. He was successful. Then what happened over here? On the first night, she was worried because her friend had told her that you will bleed and you will bleed and there will be a lot of pain. So she was really worried. One who could be examined by a gynecologist, he didn't allow penetration. This boy started, there is something has gone wrong because of this principle. So you should remember, that you should try to see as far as a sexual disorder, it can be who is representing the case and who can be suffering from the case. That is why I always say your history, your treatment will be incomplete unless until you call both the people in your clinic and take a mail. First, you ask both of them to sit together, say what is the problem. Then you ask them that you decide among you who should be first and who should be second. And the third part, take a male separate history, female separate, and then combine, and never try to say what has been given to you by one person to another. I think if you do those, I think you will be able to find it out. So this is a very, very important thing as far as the effect of one partner to another is.
Okay. Coming to, shall I?
Please feel free, huh?
Okay.
Ask each other. We can.
I look at it as a problem from 3 angles. You see, one important point is when we say sexual problem, it is almost always a unit is one man and one woman. Let us not get into that third gender and whole lot of other issues. What it actually means is, say, for example, if a man is able to perform once a month and the wife is happy with his once a month performance, there is no problem at all. She needs sex every day and he doesn't perform, then only the problem arises. Or he wants sex and she is not interested. That's where actually one of the issue comes. So when we are trying to talk about whether it affects the partner, the very basic definition of sexual problem, and when we say it is pathological, it is the involvement of 2 people. That means automatically, directly, indirectly, both are affected in one way or other. This is for the first point I want to emphasize. The second point is, see, many of the times when patient comes and presents, what actually is happening, who is actually having the problem, that itself may be actually sometimes difficult to know. I remember very, very long back, one of the case, and many of the times in my presentations, I repeat this particular case. One person married his distant cousin's daughter, and in fact, 4 years, she has not allowed him to come near. In fact, psychiatric terminology, in fact, at even that particular point, what diagnosis is sexual aversion disorder. At the end of 4th year, he went and told mother-in-law that I can't wait any longer. I want to marry somebody. And when mother-in-law told him, you come tomorrow, everything would be solved. He went home. It was a big house and they had put a cot in the hall, and this girl was running helter-skelter here, there, and all of that. And ultimately, there were about 5 or 6 ladies. They caught hold of her, brought to the cart. One lady holding one arm, another lady holding another arm, one lady pressing the pelvis. They told him, you perform. He says he removed the pant, but he couldn't get the erection. And everybody told him, you are having actually erectile problem. Why you are making so much of fuss? He comes running and, sir, I am having actually erectile problem. Please help me. What it means is, who is actually having problem unless we spend some time. Dr. Raj Brahmbhatt made that point very clear, that history. Extremely important for us to go through and try to establish what is actually the issue that is happening. Many times we get the patients who comes alone and says, wife doesn't know. Many of the times, this is an absolutely not a right statement, because wife will be the first person to know. Only thing is, in our country, they are extremely grateful to, or in fact, considerate of their husbands, and that's why they don't make big fuss about it. And this particular man believes that she doesn't know. And many of the times we have seen, when patients come, either wife has told, or one of the term used, extramarital affair, this, that, and all of that, and that some other lady was not able to perform. That is the time actually he becomes a little conscious. I need to have something actually to evaluate it. Many of the times in the family situations, he will neglect and she will neglect, and both of them might be going through without much issue. The third one, the point made that either premature ejaculation, pain and penetration disorder, each one will have a definitive role to play in creating quite a bit of difficulties in the other person, not because of anything. Invariably, in fact, when we are trying to talk about 2 people, one's needs and other's needs both have to be, in fact, to reasonable extent, one should be able to meet. Lacking means automatically psychological to lot many other problems invariably come up. And one of the very nice part of this particular question is that the other person is also extremely important in the whole scheme of things. Thank you.
Thank you, sir.
Yeah, I totally agree with both of you, sir. History should be a couple history always. And in the rural area, many times they don't open up, or one will try to hide something. Then, and especially in cases of infertility, we have to go into the details. Yeah, we totally agree. Thank you, sir. Regarding the management of female sexual dysfunctions, how should we start to evaluate the case? Whether there are any specific investigations and how to manage?
Very important. Again, I would still go back to the history.
Yeah.
First of all, you have to be very comfortable with your own self. Secondly, as I said, you should be able to pick up those cases. Then there should be a total privacy. And
Yes.
first, you should tell them that whatever you talk to me is going to be totally confidential between you and me. It will not go to your wife, or it will not go to the referring authority or any government authority. Then they are very comfortable. Because this is a very private subject, you know. If we are two friends and we will have to talk about each other's sexuality, we won't be able to talk. So this is the first thing. And secondly, there is a caveat to it, that if you are going to harm yourself or harm the society or anybody, in that case, I will not keep a secrecy. Now, once you have said, and as you have said again and again, as you said that it's very difficult for a female partner to come, or in a rural area. Now, what you should do, first of all, you should ask him whether you have told your wife yes or no. And he may say that, oh, she has sent me that I am not doing okay. In that case, you can always say that, can I talk to her over a phone? And then he's very comfortable. The moment you take a phone, say that, you know, I'm putting on a speaker, but the gentleman will be out. Once he goes out, then you talk and you'll be surprised to know female are the most honest as far as the sexualities are concerned, while men are the hypocrite. Male whole self-esteem is in the penis and in his erection, while female will absolutely openly, they will say. In the history, right from the childhood, you have to go up to the marriage, and what is the recent thing going on? A very simple thing. You take a, whether like a medical history, you take it whether it was, you know, suddenly it has happened, then invariably it is pure psychogenic. While diabetes, blood pressure, drug effect, it will take a longer time. So that is an organic one. Psychological history and the sexual history is the most important, which I am going to focus. As far as the female are concerned, ask them about their desire. Then lubricate. Then during penetration, do they get any pain or other things? Ask them whether you reach an orgasm, and you'll have to explain to her about the orgasm. Ask the history of masturbation. Any sex education was given to them. Most important is any sexual abuse in the childhood or any other. This is invariably we overlook it. And I realize that when you ask them, sometimes you will open up the whole thing and the whole solution will be there. Ask them about whether they are watching porn or not. And if they are watching porn, what are their ideas about normal sex? Because what they see or what they read in the WhatsApp university, they think it is perfectly right. So you must clear up those things, because people have got idea that sex should continue for more than half an hour, 1 hour, or their friends are telling. And they find that their partner gets over within 2 minutes as per the ejaculation is concerned. And they think that we are the most unlucky people. This is the maximum time you will get such a patients, you know, who will coming to you. And the last but not least is whether sex education was given to them and what are their sexual orientation. These are very, very important questions. As far as the social aspect is concerned, ask her about how is your relation with him, how much is the privacy in the home, how much is your relation with your mother-in-law. And in some of the community till today, the dowry is a major problem. So if those things are there, it will come up as far as the sex is concerned. Now, as you know, examination, as you know very well, One thing, if you don't do, it will be criminal, that is diabetes. And with your acumen, if you find in cases wherever it is required, a thyroid studies, or at the same time, vitamin B12, vitamin D, these are being missed, or anemia. And if you can do, these are the, as far as the examination is concerned. Now, examination about the male. She has got an idea that the male is not getting erection. Now you see, Madan, as you are a male and lot many female comes to you for an examination, they don't mind. But if I ask Vaidehi, have you ever examined the male? Are they comfortable with you? They are not. As I said, they would not strip in front of a woman. So if you are practicing, how are you going to do this? And I have developed my own Raj home sildenafil citrate test. Initially, it was an office test. How they used to do? If there are no contraindication, call them in the office, give them sildenafil citrate of the choice, 25, 50, 100 milligram, whatever is required. Ask them to stimulate and examine. Now, this is not possible. So ask them to be in their home, take a light dinner, no drinks, sildenafil citrate 25, 50 and 100 milligram. Let them watch the porn or read something and let them stimulate themselves. And after stimulating, tell them to take a photograph on the top and on the side. And when they come to you, you will be able to see. So three things are there. One is a history taking, second is examination, and third is investigation. And if you ask me, what is the most important part? I take at least 1.5 to 2 sessions sometimes, because they come from all over, they have moved and come. To just take a history, and history is the first important, second important is history, and third is the important history. So if you can do, this is the way you can evaluate the whole case. And as I told you, being a male, how you can manage the female, and being a female, how you can manage the male.
See, when we are talking about evaluation for female sexual dysfunction, one approach is what actually was Dr. Rajabrahma was mentioning. That means history, and history. That forms one of the key component. We have some specific tests for the man, but as far as the woman is concerned, there are no specific tests at all, except that, say, for example, of course, metabolic syndromes, anemia, thyroid, other hormones. In fact, from treatment point of view, the hormone replacement therapy. So these are the few of the things which are there from particular reason, keeping in mind, one can evaluate. I'll go back to another one. In fact, maybe next you are going to ask some question. How do you do the treatment? I'll not talking about treatment and how you evaluate what I'm telling. History is extremely important because just like the Plicit model, there are some questions they have which need to be answered. Say, for example, whether I can have sex during menses. In fact, it may look very simple, but nobody has told them whether it is the right thing to do or wrong thing to do. Whether one should have sex only during the night or in fact during daytime. When can, how many times one should have sex? These may be some of the very, very simple questions. Many of the times they don't have answer. One of the, when we are trying to talk about female sexual dysfunction, see, we did a study on about 500 plus women who were from the elite group, in the sense that there were wives of Lions Club and Rotary Club, married for at least 1 year, staying with the husband. And we were trying to evaluate, in fact, based on the question at Marston Johnson's female inhibitory female sexual function questionnaire. One of the most important criterion there was, in fact, I can speak on that for a pretty length of time, but all said and done, from focus on evaluation, one component is whether you initiate, and in fact, how many times you masturbate. See, when you try to look at masturbation, only around 32% of the women, this particular elite group, what I'm talking about, they reported yes sometime, but only 12% were reasonably comfortable. See, now you look at the Western figures available, it is around 60, 70, 80. And when you are trying to talk about female inhibitory dysfunctions, whatever, the whole important idea is actually making the woman understand herself. In fact, masturbatory training and many of these type of things get into the picture. That means even among this elite, what called urban population women, 70% they don't know that what is actually the pleasure component and how actually one will reach orgasm and whole lot of issues. Many of them would be presenting with, many aches and pains, multiple somatic complaints, in fact, emphasizing emotional cause, de-emphasizing emotional cause, asking for frequent tests related to what we basically call penetrative, such as, say, for example, endoscopy, colonoscopy, many other such type of tests. They all indicate there is something actually missing. So this is where actually we have to be a little sensitive and try to go into the details related to. There are some people who actually need very detailed evaluation. One of the most important point what I would mention at this particular point is actually the unconsummated marriages. See, unconsummated marriages, they form a separate section altogether because the management among these individuals is actually something has to be intensive and a whole lot of these things. Just like Dr. Raj was mentioning, we have something, in fact, sometimes I'll tell them they should get admitted for about 2 weeks or 3 or 4 weeks for the simple reason that it is almost like going for honeymoon. Keep aside everything and focus on this particular thing. That's time actually we can spend enough time to understand their problem and how actually, in fact, both man and woman can be trained. So when we are trying to talk about evaluation in general, and evaluation particularly when we are trying to talk about female sexual dysfunction, there are some biological, and many of the times female sexual problems are relational problems. I think the whole gist of what Dr. Raj Brahmbhatta mentioning was, it is relational, and relational. A whole lot of gamut of questions and details related to that one has to obtain, and this is extremely important. Routine tests are there, specific tests are there, and one can. As far as the man is concerned, we have very specific tests. One is actually what Dr. Raj Brahmbhatta was mentioning. Scan, nocturnal penile tumescence, and lot many other things can tell us about what actually might be happening to some extent. But again, in both man and woman, and very particularly as far as woman is concerned, it is history, extremely important components.
Okay, sir. It was very elaborative answer actually. Sir, what about the medical treatment, drug treatment of female sexual dysfunctions? What is your opinion?
See, in Journal of Psychosexual Health, we have 2 articles, very specifically. One we wrote almost about 3.5-4 years ago on flibanserin. And the one more article which came editorial was on bremelanotide. See, when we are trying to talk about drug treatment, first of all, the idea here is actually to establish the basic parameters and whether there is hormonal and such other abnormalities. That is one. The second component, in fact, World Psychiatric Association goes by the classification where it is a multi-axial system. Axis 1 talks about specific sexual problem for which they have come. The second component, 1B, is comorbidities. Comorbidities, why I am emphasizing this point and I am bringing this World Psychiatric Association classification system is, for all practical purposes, anemia and many other such things are so common among females. Thyroid-related issues are so common among female population. One has to give adequate importance for this particular area. So when we are trying to talk about treatment at a very basic level, so if there is a depression, it has to be treated. There are anxiety-related, there are actually specific drugs are available which has to be made use of. And there are a whole lot of what we basically call hormone treatments. Say, for example, judiciously using testosterone, how one can do it. How, in fact, whether there is a deficiency related to estrogen and such other things. In fact, many of the people, you gynecologists must have done surgery, and what is the extent of surgery that was done, and whether ovary retained, not retained, and many of these things as the aging process itself, issues related to. Only 2 drugs, in fact, specifically what has been mentioned from female sexual dysfunction is actually these 2 things. Coming to flibanserin, personally, I have not used it, but I have, in fact, as a journal editor, one of the articles that has come out, actually we rejected it, not for any other reason. But again, a whole lot of the work is actually already which is there. And what is the current status in India? If somebody has, hardly there is anything worthwhile information available as far as this particular molecule is concerned. What actually it does, It is a partial agonist related to 5-HT1A level at serotonin receptors. And it is supposed to, in fact, those drugs act that particular level. They increase what we basically call the mood, the arousal, and beneficial effects in overall this 50 to 100 milligrams. And one of the things, in fact, there are actually, when you are trying to look at the basic 4 tests which were actually done as far as its usage is concerned among the females, the different names have been in the Rose study and Lily study and like that. Ultimate conclusion was, even in the Western country, if this particular drug is not acting for the next, in fact, within 8 weeks, there is no meaning in continuing this particular molecule. Bremelanotide. In fact, this is one of the drug again and the same mechanism of action, but unfortunately has to be given parenterally. The reply, in fact, the data available indicates they have not changed anything significantly as far as women are concerned. See, sildenafil citrate, tadalafil, and lot many other PDE5 inhibitors brought about remarkable changes as far as the men are concerned. But as far as the women are concerned, FDA has not approved this particular thing. Even in case of women, the genital sensitivity increasing. In fact, ultimately, it is a swelling and lubrication response as far as women, what we talk about. This has beneficial effect. 50 milligrams, 100 milligrams, off-label. In fact, one can try. This is one more other point. So there are few drugs, but unfortunately, nothing has stood test of time to say that this is the answer for the female sexual dysfunction. Again, we have to go back. It is a relationship and lot many other aspects which are actually extremely important as far as the female is concerned.
Can I contribute?
Yes. I want to ask, sir, whether these drugs are available in India or not, flibanserin and bremelanotide.
Bremelanotide not available.
Not available.
Flibanserin, they say that it is available in Mumbai and certain major metro cities where one can get it.
Okay.
Not available in the regular sequence of things.
Okay.
Before you start, can I contribute to it,
Yes, sir, please.
As you were focusing on the drugs, so I understand we are in the stress century, we are in the, fast life. We want the drugs, one medical representative will come and say some nutraceuticals he is giving. He says, you do this, do that, and you will run to it. Now, as far as the first is that if there is a hormonal problem, you people know you are treated with the estrogen, you are treated with the testosterone, and unless and until there is a biochemical evidence, do not try to take it. As Dr. Rao has rightly explained to you, as far as the flibanserin is concerned, it is available AD, and in India also it is available many drugs. I have not used it, to be honest with you. First of all, they had done 3 trials and out of them 2 rejected. But right now, this is the only drug which is FDA has approved as far as the USA is concerned. Unfortunately, it has to be done it is not useful after the menopause. So it should be before menopause. Along with alcohol, it can create a hypotension. And as Dr. Rao said, it has to be taken for 2 months. And the change is hardly 1 or 2 times, they have a frequency of increase. And as far as the other drug is concerned, it is to be given, subcutaneously. So I would say these are all the drugs. But the most important part which I would like to tell you, you may be in any part of India. As I said, history will give you, don't try to run to this thing. There should be a graded things. First of all, you find it out. First is a sex education. And you will be shocked to know that highly educated people, even I had a doctor couple from KEM, they did not have idea about sexual position and other things. So you should keep some models and show them, with the wooden models or maybe the dolls or with the pictures. Second is the most important is the counseling part, which you are forgetting. So unless you do a counseling and then the Plicit model, I would request all of you to go through the Plicit model. If you do permission giving, limited information, then specific suggestion and intensive therapy. So only a small amount of people you will have to require to send to Dr. Rao or to me or any other consultant in sexual medicine. Most of the thing, if you wish, you will be able to do it, I can tell you. Then oral medications are there. Now, before you give, as I said, biopsychosocial, so psychologically, try to find it out, is there a lot of anxiety, depression. In those cases, a mild anxiolytic and antidepressant you can give them. But you'll have to be very careful that they do not give any side effects as far as the sexual side effect is concerned. After that, now PDE5 inhibitors are there. Then lubricants. And most important for all of you to learn is teach them Kegel exercise. It hardly takes a time to teach them. After oral medications, new avenues have opened up today. Botox, laser, gene therapy, stem therapy. I had recently been attending 4 major conferences. And you'll be surprised every time something new coming up, and there are reports not only in India, international report, they are showing a lot of changes. So I think these are the thing, and vaginal aesthetics, all those things are coming up. So when you say don't just try to jump to the drugs only, go through the graded this thing, and you'll be able to do much better help to the patient. All of them, because these all drugs which are there, either availability not there, side effects are there, and they are still, there are not robust evidence is available for them. So, and people have given sometimes food like Satavari, Shilajit as a drug they have given, Methi they have given. Now, anything which is traditionally being used, you can allow them because these are harmless. Okay?
Sir, as we are discussing the drugs, whether these are approved by FDA of India?
It's for example, in India, it is still not approved drug.
Then
But off-label, one can use some of this. So, for example, even sildenafil citrate.
how you can use officially?
The point is, there is no restriction. In fact, people have documented that it has some advantages, but they have not documented its absolute effectiveness in case of female sexuality. As far as the male is concerned, yes, it is approved. See, I'll tell you, we were doing the initial part of sildenafil citrate trial. In fact, Dr. Raj Brahmapad was one of the PAs for that, actually, what I can remember. One person came and told he gave this particular tablet to the wife, and she on that day very got excited, and she came and hugged him, and there was a sudden change in her behavior. These are all some of these anecdotal type of experiences, which is just not sufficient. Say DCGI can give approval for these things. But there is nothing like a total ban on this particular drug to be used experimentally on population, where specifically India.
I would like to add what Dr. Rao told in one of his meeting, very beautifully, and that I have carried and it has gone to my heart. He said, when 1998, the revolution occurred, there are 4 drugs which has changed the life of the mankind, and one of them was sildenafil citrate. So they thought that this is a Ramban for every problem. And then later on, some studies of more than 2,000 to 3,000 women in Japan was done. If you remember, Satya, you had quoted. And they were surprised that it has not made any difference to their life. You'll be shocked to know that it has not made any difference to their life. So more important, as we said, relationship is very important. And you will be another shocking thing I'm telling you today, that after sildenafil citrate, which came up, after 2 years, the Japanese women came on the road that we should be allowed to use contraceptive. Till that time, they were not allowed to use it. So you can imagine how bad it was. One thing I forgot to put over here is a device called Eros, which is FDA approved. It is available from abroad. What is this? In many people, they do not have idea that what is the most important part as far as the female is concerned and her excitement, and that is clitoris. And nobody thinks. And as you see that as far the male is concerned, it's very easy. In one penis, the urine passes, semen passes, and pleasure is also there. In case of a female, for reproduction is a vagina, urethral opening, and the clitoris is. So Eros is a small, which can be kept. One of my patients, she showed me, her husband was abroad, so he brought it and gave it to her. It's a very small, nice purse, it is there. And with that, they can stimulate clitoris. And here one more thing, that you must ask them the history of masturbation and teach them, ask them to examine themselves and how to masturbate, teach them over there. That will make a lot of difference. Because Masters and Johnson said 30% of the women, they will never reach an orgasm. So these are the things which will help. So just you cannot say that the drugs have come, give the drugs. No, I feel sometimes putting a board outside my clinic. I only treat Viagra failed cases, meaning the sildenafil or any drugs failed. Because people write it down, they go, they think it's okay. First of all, it's very difficult to find you. And once they do, and they think that if this is not working, nothing is working. So you have to have a complete history. Then the goal, what they want a couple, Some people say we want the shortest thing, in those things they think you do. Otherwise, when we talk about sex therapy, you will come to know that how beautiful it is and how you can help them out.
Because there is only one small point. See, as far as female orgasm is concerned, there used to be a condition called as anorgasmia, frigidity, what very commonly people used to use. Now we believe that there is nothing such condition. It is only pre-orgasmic state. And with the vibrators, almost 100% of the women can be taken to the orgasm, according to the reports. But it may be a little exaggerated. And every man has so many vibrators. There are actually 10 plus 1. There are 11 vibrators. How he precisely uses it, that actually depends on that.
So what Satya is saying is very, very true. That rather than going to the gazettes, God has given you all the things, and when you say most of the time, the whole sexuality is from male oriented. Moment he gets feeling like desire, he goes, wakes her up, penetrates, ejaculates, and he reaches an orgasm. Well, as far as the female is concerned, it's not that. It takes a time for her to come to that level. So our teacher have said very easily that when you start the gas and the flame is on, so that is a male. But you put a tawa on it, it takes a time to get hot and time to get cold. So as far as the female is concerned, this is a very, very important aspect which one must. So the best thing is a foreplay. And many a time people have forgotten. So I would say that you must ask them one of the thing in the history, how is your sex act? Can you describe to me one of the sex act? And there is a monotony? Is there any other thing? There is some colors added to it, and that will give you. And then ask male and female, both of them, to separately write it down that what you like your partner to do it, and you will be surprised they do not know anything about their partner. So rather than jumping to all the things, I would still say a foreplay and mutual masturbation sometimes that can also teach them how to reach to an orgasm. And one more thing left out, which was lubricants. I think you people are using lubricants and the moisturizer day in and day out. And that's a very, very important part as far as the menopausal women is concerned, those who are not getting good lubrication. So once you have removed that there is no infection and other things, we have ruled out those things. In those cases, you can use the lubricants. And there are 3 lubricants available. One is a water-based, oil-based, and some contains 9-oxynol-9. So you should be very careful if they are coming from infertility. Ask them about a question on their own. Are they using it? And they are continuing it. And people have used the home lubricants like coconut oil, castor oil. I remember in the village people used to use it, and now fancy people are using aloe and also olive oil. So these are the things one should keep it. But if you have a good foreplay and if they are below the menopausal age, they will be able to have a good, unless there is a lot of marital disharmony between them.
Sir, you have pointed out a very good point as far as infertility is concerned. People are using lubricants.
Yes, many a time we forget.
Yes.
And people have been using it, and then you will come to know that, oh my God, because they have continued from the day one, which has been told to them, and nobody has told them when not to use it. So I think, again, I'm bringing one more point, that if such patients are there, first time when you take a good history and spend little time in explaining, you'll be saving many trouble of the suffering population. As far as you have used the one infertility, I'll just say one. Now, everybody wants a shortcut. They want to go for IVF, and that's why you see all around India, IVF centers have been opened up like a mushroom, I'm not saying no. What has suddenly happened? Why we suddenly started? Because the first is marriage age has gone up. Then they want to do career. And then suddenly they don't want to have babies, so it's the easiest way out, but they don't know. So here in Bombay, one couple, they spend a lot of money over here. The eggs were not fertilized, left it. This was in a suburb. After 2 years, they went to city, the major part around the major centers. And there also it failed after 2 years. And then they shifted to Scotland. And in Scotland also, the same thing happened. Now, what you have to say that if somebody has, before you start the treatment, you say that all the time you may not get the result with the first thing. If it doesn't occur, then we will have to go into detail and find it out what are the problems. And then you pass on to other people. Otherwise, as far infertility is concerned, every center goes on doing the same test again and again, which should not be done. This is, so again, taking a history, giving them a counseling, explaining them, and asking them if there are any problem. I think you'll be able to help out people in a better way.
Yes. Thank you, sir. It was a
I
great
think
inputs. Yeah.
we got we had a very elaborative discussion on the pharmacological part of female sexual disorders. And now my question to our speakers is, apart from this pharmacological treatment, do we have any non-pharmacological approach for these female sexual disorders?
I have already said, madam, education, counseling, Kegel exercise, implicit model, teaching them how to masturbate. Then the devices like this vibrator or, Eros. And the most important is a sex therapy. As Dr. Rao has said, we two people are here with one of the pharmaceutical company. We had done it in around, more than 20 years back, a study on a double-blind, multicentric crossover studies on sildenafil citrate. Now, after that, I found that sildenafil is not a Rambad solution. And then I said, I have been practicing from 1980 onwards. So all these years, how I have treated the people. And unlike any other fool, we have given tons of testosterone which were not required. Some yohimbine-like drugs. Some of the sex tonic which were there, alcohol, cocaine, marijuana, Spanish fly, lizard oil, horns of animal, ginseng, shilajit, amphetamine, oysters, and last but not least, the palang tod pan and hormones. But the most important part, what we have forgotten, is 1970. Masters and Johnson came out with a book called Human Sexual Inadequacy. And in that, what they used to do is give us sex therapy. They call it a sensate focus. So without medication, you will be able to do it. And you will be able to get a good amount of charge and other thing. I have been conducting many workshops as far as the sensate focus is concerned. And I have converted into Indian scenario. See, what they used to do, Masters and Johnson, they were a team of husband and wife. They used to, first the male used to examine male and female used to, and they were asked, you leave your home, leave your office, and come down a small place of, their particular area where there are cottages. On the first day, master will speak to the male, she will talk to the female. Next day, there's a crossover. The female will talk to male and male will talk to female. And third day, what they will have a roundtable conference, in all this. By that time, investigations are over. And then they teach what is called sensate focus or talk therapy or touch therapy, which I have converted into a sexercise. In our country, people are now health conscious and they will be able to do a sexercise. So once you do this particular thing, I think you will be able to help him out without any medications. Over to you, Satya.
Of course, when we are using the term non-pharmacological, there are a whole range of therapies are available, and I think it has been already mentioned. Because we are running out of time. Most important point is actually when we are trying to talk about female sexuality, non-pharmacological treatments become extremely important aspect for understanding, and there are a whole lot of lifestyle issues are there. I think later when some question comes, I'll try to answer that particular point. So, point is well taken. It is a relationship issue, and again, range of non-pharmacological treatments, what has been mentioned, has to be followed.
Okay. Thank you, sir. Vaidehi? Okay, I think she has lost the connection. Sir, next question is, how does the estrogen and testosterone therapy works in the female sexual disorders?
This
Yes.
for me or?
Go ahead. You go ahead, then I'll add if something.
Yes, sir.
Okay. See, in Lanka, we were conducting one program, and one of the gynecologists, she was telling, she was maybe something around 45, 50s. Oh, I had to take the shot of testosterone regularly. I'll take. When we are trying to talk about female sexuality, people have documented that more particularly perimenopausal and menopausal area, there may be issues, and when we are trying to talk about libido issues are there, this can bring about remarkable changes. One of the more specific drug, of course, estrogen. I'll not go into the elaboration of, because you all gynecologists and obstetrician, you are using it regularly, and elaboration of that is not necessary. But the important point is actually recognizing properly and treating is extremely important. One of the things what happens is the appearance of pain and the penetration difficulties and many of these type of things. A lot of disturbance there.
Yes, you are there. Go ahead.
So, unless we correct that particular point, it actually can lead to quite a bit of difficulties. That's why when we are trying to talk about management, this collaborative treatment involving gynecologists and whatever hormone replacement therapy need to be done, has to be done. And what the amount of testosterone, if you are trying to speak, there may be some exceptional cases where this is used in that particular fashion. And judiciously combining to avoid various side effects which may not be liked by, cosmetically speaking, by women. To, in fact, it just brings about that arousal and improvement in the mood and from that particular angle. Even in case of man, we have to be a little careful in the sense that these are all
Yes, you are there. Go ahead.
Lifelong treatments, and a lot of sounds are there.
Somebody's. Go ahead, doctor. Dr. Satya, go ahead.
Okay. Sound. I was just wondering from where this particular sound. It is adding music to the program, actually, I thought. So one has to be very little, very judiciously make use of it. Again, let me tell you, this becomes only one small component of female sexual dysfunction management.
As you know, Dr. Madan, that you have been using, estrogen.
Yes, sir.
Systematically, you have been using. Now, testosterone, definitely it has a role as far as the libido is concerned.
Yes.
Before you give it, see, it has been, there is a lot of evidence is available as far as the testosterone role is concerned. But it is still considered as an off-label treatment. Directly, it has not been said that you can use it in this particular fashion. Two things you must keep in mind. That if it can develop, it should be used even before and menopausal women also around that area, perimenopausal. But it can cause hirsutism and acne. And it should also, there are not many studies available which directly says that what is it will be its effect as per the breast cancer is concerned, and also cardiovascular system is concerned. And if at all you have to use it, there should be a biochemical evidence. Then again, periodically you assess that whether they are feeling good about it, and it should not be continued more than 6 months. That is what I would suggest as far as both the hormones are concerned.
Biochemical evidence means we have to do serum estradiol levels.
You should ideally, even serum testosterone level should be done, that it should not go. And what, there people have been using patches. I have never used patch in my life. And as far as the injections are concerned, so injections are, either, aqueous solution or a oily solution. But once you give oily solution, you won't have any control for the next 3 weeks. So one should try to find it out, and see that whether there are tablets which are oral tablets which are available. But there are not many good. It can be as Dr. Rao has said, that some reports comes up, but you cannot say that this will definitely help. And this is what you can do as an AMOGS people. Ask, 20, 25 people across the, your group in Maharashtra. Tell them one problem, you take it up and say that use this and find it out. And then at end of the 3 or 6 months, you will have a real good studies which can be done apart from this. I would definitely recommend all of you to do this.
But as far as the menopausal symptoms are concerned, the vulvovaginal atrophy, dryness, we all gynecologists do use local creams which are available. For example, Evolon, Primarin is available, conjugated estrogens, and some tablets are available 2 mg. Estradiol valerate, estradiol hemihydrate is have come. We don't use for long term, but we do advise for 1 month, 2 month therapy. They get the symptomatic improvements in the.
That is definitely, it has been accepted. It's a very good thing. Lubrication, lubricants and also moisturizers. I think both,
Yes.
that may be once a week or once in 10 days. But if you
Yeah.
do, and I think, either you use it or lose it. And once they are having regular sex, the problems will be much less, and they will have a better orgasm, better circulation around the same place.
Yes, at least they can get the symptomatic relief and try for.
Very
Symptomatic relief. May I add, sir? May I add? I'm a gynecologist from Akola.
Please.
Hello.
Please, madam.
Yes.
Yeah. When you are using all these creams and local estrogen therapy, there are now so many things are available now. Estrogen gels are available. Estrogen sprays are available to be applied on the forearm. But the amount of estrogen given there is much higher than what it is said in the so many studies. So, and whatever the local treatment, what the conductor, I so he was emphasizing on the Evolon gel. So Evolon gel is now withdrawn from the market. Now only Primarin gel is available. And these therapies are only given for the GSM only, means genitourinary syndrome of the menopause. They are not for the, actually what we are thinking or talking about the sexual therapies, they are not for those kind of things. Because on long-term therapy, even the gynecologist, I have come across the many prescriptions of the gynecologists. They are, when they are not regularly treating, they don't know when to use estrogen also. Even for the hysterectomized patient, even for the non-hysterectomized patient, when to add on for the progesterone, they don't really know. And they are giving much harm to the patient rather than giving them the benefits. So I really think that AMOGS should take over this point and emphasize on the obstetrician. Then when the patient is hysterectomized, unopposed estrogen should be only given. Progesterone, when should it be given and when it should not be given. All those things should be told to the doctors. Otherwise, they are harm to the patient. Even I have come across with the estrogen, local estrogen gel. They come across a patient of CA breast because of the estrogen therapy, which has come now. That patient was from the Nagpur city. So these are not the good things also. So there are not much studies, what Rao sir has told. And you have to, actually Brahm that sir has told, and you have to really think of these things because much more data is needed before starting these therapies, hormonal replacement therapy in India.
Straight away, we should agree that we are all psychiatrists and sexologists. Our knowledge related to hormones is a limited one. We usually refer this case to the gynecologist and they'll take care of it.
Yeah. Thank you, madam, for your valuable input.
Gynecologist at home only.
Yeah.
So,
Dr. Vaidey.
So we had a very elaborative discussion on the treatment part of female sexual disorders. So now my next question is, as a allopathy, I mean, as a practicing physician, what is your idea on alternative medicine or something like yoga or mindfulness? How does it work, or does it really work with female sexual disorders?
Absolutely. See, yoga, mindfulness, Dr. Rao will be speaking little more on it. But exercise, first of all, good sleep. As far as the psychiatric history is concerned, I ask them first question is, how is your sleep? Second is about the smoking part, which we have forgotten all throughout, we have not spoken. Nowadays, female are also smoking. So that is the second part, one should keep it. The use of drugs. These three things should be kept in the mind before we go further. And as far as you were concerned, saying about the yoga and meditation, a good sleep, good exercise, good diet, and away from all, like a moderate quantity alcohol and other things. If they drink, moderate means once or twice, a party drinks, maybe 1 or 2 peg. I think yoga is 100% going to help them because it increases the blood circulation, it increases the mental well-being. And the first thing which is happening whenever the sexual problems are there, you will find them that they are depressed and they feel low. The moment their body image increases by doing yoga or by doing some walk, tell them at least 3 times a week, just do a morning walk, remove your shoes, walk on a grass just before the sun, and I think you'll see that there is a lot of good improvement. These are my personal experiences from my patient, and I'm sure there may be many. Dr. Rao will be able to tell that many more cases. And as far the mindfulness is concerned, after the CBT, most important thing is coming up is a mindfulness. And here and now, and that will help. I will ask Dr. Rao to elaborate on, I think, CBT and mindfulness because they are very important.
The point is, whether we are talking about yoga, mindfulness, relaxation, taking some amount of time as a leisure activity, everything is going to add to the woman's sexual life. I'll just give you one very recent case what I was stating. Say I practice in Mandya and this particular patient is from this place, working in Bangalore about 100 kilometers away. She gets up in the morning at 5 o'clock. She prepares breakfast for in-laws. She packs her food and for the husband. She goes to the office there, finishes the work and comes back by 8 o'clock. And again, she has to prepare food. And in fact, her complaint is, I don't have any strength or I don't get anything feeling related to sexuality. The whole treatment here is actually appointing a cook in the house for preparing food. The sexual problem in this case is not treated by either giving hormones, drugs, or other therapies at all. Take her out of this drudgery of a day, and that makes wonderful changes.
Relaxation.
So, relax. See,
with you, my wife, we are the classmates. And I used to come from the clinic, sit down, start the TV, watch Arnav Goswami or something. She'll go to the kitchen. She'll, prepare the food is already prepared. She'll come and put it over there. Then she'll take away the dishes. She'll take care of the kids, when they were young. What will happen tomorrow? So female, I was reading very beautiful thing that in her, she's a multifaceted person. She's a Shakti. She has a many roles to do. And each role changes. First, she is as a daughter, then she gets married, an ideal wife, take care of the family, takes care of the in-laws, other things. Children are born, she is looking after those things, marriage, dealing with them. I think she is, if you see, that her role keeps on changing, and that's why the priority goes on. And if you remember, Vaidehi, in the olden days, I have still cases, I remember 30, 35 years, female were not interested in the sex. They said, एक बच्चा हो गया बस डॉक्टर साहब बहुत है बाद में मुझे टच भी नहीं करेंगे तो चलेगा. And today, unmarried girls comes from the all over the north and they say, sir, we want to find our G spot. Oh, my friend is not giving me a multiple orgasm. Or 9th standard girl in a Bombay comes and tells me, he's my friend, he failed, I just want to help him out. There are no string attached. So I'm going to see a very different types of thing in a city of Bombay and metro cities. And one side we have got our Madan who says that what happens is dealing with from the whole district people. So I think sex is one thing that you cannot say this is what will work and this will not work. And I totally agree. And one more thing, Vaidehi, what I do in my sex therapy, which I have converted into Indian scenario, in Indian, this thing is sex exercise. And I make each one of them to sit down for, first say, close your eyes on, before closing, I say, put your hand like this, keep a smile on the face, close your eyes and put your head down. And I say 5 minutes, you just try to put, that's called, I say it's a relaxation. It is not a meditation. It is not some big things, yoga or other thing. Very simple thing. And see that you don't fall, you have a comfortable sit. After 5 minutes, before the 2 minutes, 3 minutes, they start fumbling. And when I ask them after 5 minutes, invariably 30 to 40% of people, when I ask, how did you felt? Your feel is feeling light or heavy? And they say, फिर भारी हो गया. So I said, तुम freeze में कोई चीज रखेगी तो ठंडी होगी कि गर्म? And I tell them that if I do MRI CT scan, it will not help you. This is a very simple way to. So when he's going, suppose once time, how I take it over there. Once he has failed as per the one sex act is concerned on Saturday night, he's worried. He's worried that very something is gone wrong. And they immediately go to Google Guru. And they find that they come out with a diagnosis. Sir, I have got a ED, whether if they have got a PhD. I said, Baba, you sit down. When did you got? No, last Saturday night I got it, and I realized that I've got a ED and I need, and I'm also smoking. Now smoking was occasional smoking. So they come down with this. So these are the people when they go for a next time for a sex act, they are becoming spectator of their own thing, whether I'm getting erection or not. He's touching her and he's feeling nothing. And that's why sunset focus is I would say in Bombay now, a lot of redevelopment are occurring. After 20 years, 30 years, everything has become, dull and the buildings are falling apart. These are the time when you need to, it will bring a new life in that. And it is not that ordinary thing that people think that non-genital, genital, and 1, 2, 3, 4, 5, 6, some of my colleagues are doing it. No, it's a totally different person to person, and it's a very dynamic thing. And at the end of that, you'll feel so happy that the Titanic, which was sunken inside the sea, you've gone underwater, gone into his mind, her mind, found it out, biopsychosocial problem, and again reunited them and redevelopment has occurred. And that makes you very happy. So I would put it in that way.
The whole problem is the women are more powerful than men, and they are capable of multitasking. That is unfortunately the whole situation where the world in general, a lot of things are put on women's head. And when we are trying to look at female sexuality, orgasm, and other related things, even in the peak of the sensual response also, she is worried about whether her child's bag is ready or tomorrow's breakfast, what she should prepare. Now you got the point, whether the roof is leaking. So these are all the things actually work on her mind, and sex becomes only one of the small component of her life, or in fact totally gets neglected in this process.
But you're saying after that, or during that, but before that she says, no, aaj headache hai. Today I had a lot of work. Have you paid the bill of the electricity or not? Have you paid this? And then you are fine. So these are why they is smiling, very big smile. Why they is thinking that how big.
I just had a WhatsApp video on this. So unfortunately, I couldn't share it. But it was, to be honest, there was a couple and they were just trying to figure it out. How many out of 100 the male was able to convince the female for the sex. And almost 80 to 90% times, he was not able to convince her. And every time she had a very different reason. The reason used to be very different from the previous one. So only 10% of the times he used to be successful in convincing her for the sex. So it is not only about multitasking, but it is also about interest and not
always, of course. Anyway, we are coming to I think the important point to wake up to others who may be actually feeling a little drowsy. The point is, there was one American, one African, and one Italian, and an Indian. And Italian says, I burn almost about 800 calories during sex. American says 1,200. African says 1,500. Then Indian says, to make her agree, I spend 2,000 calories. This is the story.
So, sir,
proceed.
Go ahead.
So, sir gave the very broad aspect of pharmacological, non-pharmacological, and alternative therapies like yoga, meditation, and all. Sir, can you just share if any one of you have any case on performance anxiety or performance anxiety, and how was it managed practically?
So, I had a initial practice. There was a gentleman who was a brother-in-law of one of the leading doctor of Mumbai, and he was in Calcutta. So he got married, and for 1.5 years, he was a highly educated person. 1.5 years, it was an unconsummation of marriage, and he could not do it, And he said, can you take care of him? And when I came to Mumbai and I took a little detailed history. And what happened that on the first night from Calcutta, they had gone for a honeymoon to Darjeeling. And he was so excited. Friends have told him, now our first night has been, very grossly, glorified in our literature, in our pictures, and the friends, they tell the stories, So he was very excited. Before she comes in, he got a little discharge. Now, this was nothing any one of us can take care by with the preset model, that it was nothing but, if you go into little detail, it was a corpus gland fluid. And he thought that he has ejaculated out. And then he was terribly worried and he said, tonight we can not have, I am not having, good mood. It's paining in my stomach and all those things. And then he went on thinking that, yes, I have masturbated. And masturbation is one history you must ask. There's a very, very important, and size of the penis for the female. Because when they watch the porn, they think that, her husband has got a very small prize. And the third is a premature ejaculation. There's three things you should keep it in the mind, and you need not have to do many investigations. Now, what happened that when he was brought to him and he was explained, because first night for a man is to show his manliness, and for a woman to show her virginity. And once this was explained to him, I can tell you, his performance anxiety went away, taught them how to do it. And initially, such people, you can give a small amount of, tadalafil or sildenafil. And what I do is 2.5 milligram in the morning if there are no contraindication. And morning, why I give that is that for women anxiety, I want to take it away. So they are not worried. They take, and when I say that you take a while taking a bath, take a soap and apply to your penis, with that, they start getting erection. They start getting confidence. And then I say, without going to her, like rehearsal, what we do, before going to drama, take 25, 50 milligram of sildenafil on an, maybe a light dinner, no alcohol, no smoking. And then you try to imagine, fantasize, look at the porn and play with yourself. And once they get good erection, then their confidence comes back. So these are the things one can do it,
As far as the man's performance anxiety is concerned, any number of stories one can actually quote. In fact, what has one in our clinical practice, what we have come across. As far as the females are concerned, the whole issue is related to, in fact, so much of emphasis on romance, relationship, and many of those type of things. In fact, she has a picture which is something totally different from what actually man. See, man is testosterone dependent. He wants arousal, erection, and penetration, and that is the end of the story. But as far as the woman is concerned, it is actually not testosterone dependent. This is why the relationship, feeling comfortable, secure, and happy, and ambience created for that. Many of these type of things are necessary. Even a small minor skirmish actually can lead to quite a bit of difficulty. And this is what actually extreme form, maybe we are talking about vaginismus and penetration disorders to so many other related things. So extremely common. One should be almost always be aware of the performance related anxiety, both in case of man and in case of woman.
No, I entirely agree with you. As far as the romance is concerned, foreplay is concerned, this is a very important one major factor which, I forgot to tell you people. Many a times, many women comes and says, I like him, but I don't love him. He's like my father. Whatever I want, he gives me. But as far as the sex is concerned, he has never learned. Some people are very aggressive. Some people come and praise the breast very high. They would like to be very gentle, romantic. They have read Mills and Boons or Harold Robbins and sort of a things. Now, the one of the major thing which we forgot is hygiene part. Some of the people, they are smelling very badly, perspiration, socks and legs are missing, eating pan and tobacco and the alcohol that is smelling very badly. Their nails are not being properly cut. So all those things put off the women. It has to be not like that, as you say, go to the station and by the time you take a cup of tea, you'll take away saucer and put a fatka over there. It's not like that. Sex should be a 5-star experience. It should be 7-course dinner. There should be foreplay, play, after play. And that is the most important part. And I can share one thing. We had gone to 2 years back in Japan in a cherry blossoms season. And while going at one place, it was taking 3 hours. We had change our this thing because we wanted to see one of the bonsai garden. So 3 hours going, we were just singing songs and other things, and playing some games. While coming back, they said, we have a sexologist over here. Why can't we talk to him and let us ask the questions? So all questions sorts of a thing, right from the ancient period to the living relationship, to the divorce and other things. And over there, one thing which, I said, I would like to ask you one question. He said, what? And I asked all the 15 women were there and 15 male. I said, what would you like your husband to give me? And right now, whoever is sitting over or watching the video, I can tell you, we all can be wrong. They are not interested in any materialistic thing. They say we want from a husband respect, respect, and respect. So respect, romance, sex is not what you do 5, 10, 15 minutes in a dark on Saturday or any other time. It is how you treat her all throughout the life. And that's why John Bancroft had said, they are more interested in relationship, not into the physical aspects.
I think so. You touched a very important part of sex, but running short of time, I have 2-3 more important questions to ask. So I would just jump to the next question, and which is actually faced by most of the gynecologists is, what about the sex during pregnancy and postpartum period? This is the very general question which we come across, that should we do sex during pregnancy?
We have been doing ping pong. We said that you ask your gynecologist and a gynecologist says you go and ask the sexologist.
Yes.
It all depends upon case to case. Now you people have so many things, gadgets that you'll be able to say that how good or how bad is the thing. Now, first time prima, we have got no ideas about it. But during the first trimester, some of the women, they are very bad. They are feeling, nausea, vomiting, low, and they are not getting up to 12 o'clock, even in the afternoon. So these are the people you should try to see. Second trimester, if there are no contraindication, if the previous history has been good, in those cases, sex can be increased or decreased depending upon how was their sex life before. And the third trimester, one should not do the deep thrusting. That is one part. And secondly, the man should try to have different positions where the pressure does not come on her tummy. There has been saying that by discharge, is it going to create a problem by liberating prostaglandin? She will have a uterine contraction? No, it has been proved beyond doubt that they are not going to have. So what I would say, each case, because by chance, if I remember one case, he was an air purser and she was an air hostess. And with great difficulty, they went for an IVF, they had twins. They had a twin delivery, and he came, and during those days it was known, it was allowed sonography. He tried to insist her on having sex. Next day, she aborted, and for the lifetime, she was against him. So I think we cannot have any generalized thing. And before you tell them, give them a guarded response that these are the things which you should do. Anything else, Dr. Rao?
Of course. Sex is not contraindicated at any phase, but there are some special cases and situations wherein one has to be a little careful. This is, so for example, once abortion, even next time also, better to be a little careful about the
obstetric history.
Obstetric history. So that is one of the very important point. You see, in puerperium, what happens? See, when we are trying to talk about psychiatry and issues related to that, in pregnancy, there are so many good hormones are there, and for majority of this anxiety, depression, they disappear, attenuate, and a whole lot of such things. But following delivery, this puerperium is one of the very critical period in one's life. In fact, there are studies available, 1 out of or 2 out of 10 will go through a mild form of depression to a significant puerperal depression, and there are many things, and quite a bit of difficulties can happen. One of the joke, you can call it, in fact, this is actually from Raj Brahmavat only. There was a man who was asking his sister when delivery will be over, and in fact, she informed something, and he was sitting with another. And
Let us ask Dr. Madan and Dr. Vaidehi, post delivery, when they can have sex. Can you tell us?
Again, that is, as you said, it is again very case to case dependent. So it again goes retrospectively also sometimes. Like if anything undue happens with that case, then they will come to you and say, "तो आपने तो बताया नहीं था कि sex contraindicated है." So again, it is very case to case and couple to couple case, couple to couple also it differs. So there is no
Actually,
generalized.
yeah.
One of the general terminology from our point of view, we suggest is about 6 weeks following normal delivery and 3 months following surgery. This joke, what I was trying to tell, this other person asking him when we can have sex. The person telling him that it all depends on whether she shifted to the private ward or to the general ward. Now you got the point. So men have very, very different ways of looking at it.
Dr. J.V. Bhatt, who was my teacher. So this has gone to the third generation. I'm very happy.
Okay.
One case of a case, again a doctor family. They had a sex and, she lost the baby. And then during those days, IVF was not this thing. Again, she became pregnant. Now, this time they took a care. She was left to her home, maternal home. For 9 months, she was there. He could not have sex. After 3 months or 4 months, when she came to Bombay, he tried to have sex and he failed. Now, suddenly on Saturday night, when you feel, or Sunday night, you feel in one incidence, your mind says it is psychogenic. Fine. So we thought initially that it's a psychogenic, started treating it. And suddenly one of the notes which I was going through is both the parents were diabetic. And I asked him, just kindly get your blood sugar done. And you will be surprised to know it was 360 or 80. And during this 8 to 9 months, it had increased, and he was not aware of it. And because of that, he got an erectile dysfunction. So every case, I would say, again, go back to history, take down your notes, go through the notes, and it will help you to in a great way. And do not think unusual. Think of the most common thing first. And this again, as Dr. Rao said, now when somebody comes for a second time delivery to you, all MOGS people or Foxy people can ask one question. At what time you started having sex after the delivery? How frequent it was? And what problem occurs? I think it can be a very good, robust, because I heard Foxy people have got around 20,000 members. And I don't know, MOGS has got how many? 1,000 around or 500 people?
MOGS people are more than 1,000, but Foxy has got 43,000.
1/4 or 10% gives, you will have a better studies, because every time we have to give ping pong and say this, we can get a clear answer to them.
Yeah.
So,
Okay.
pregnancy, puerperium. So now what about menopause, sir? Menopause, is it the end of sexual life? Or what?
For example, see, Kinsey did the study and developmental sexuality when we try to talk about not children, even adults. See, somewhere around 40, 50s, a remarkable change happens in the case of men and women. What has been documented is, in case of men, it falls down drastically. What it means is, one is age, second one is a whole range of metabolic syndromes, maybe alcohol, smoking, and lot many other such other things. As far as women are concerned, see, it is the inhibitory female sexuality all through the life. But somewhere around 40, 50, she is liberated from these female hormones which were creating such an amount of difficulty. All through sexual history, if you try to look at, this is one of the major common problem, and that's why female sexuality in general is reported as inhibitory. The point is now, the female hormones are liberated. That means there is a relative increase in testosterone, and this around 40s, man becomes naughty. Not only that, woman also becomes naughty. This is the time her sexual desire increases, need for sex. And this is one of the reasons why 20, 30 years of married life, and now they are talking in terms of divorce and changes and lot many other things. In general, biology says woman is highly responsive and she can participate in the sex life all through the life without much difficulty. One of the most important part of the sexual life appears because For this woman, there is no issue of menstruation issues and pregnancy-related anxiety and lot many other things. She's free from lot of drudgeries. But unfortunately, all the studies documented both in the West and in the East particularly, is that there is a decrease. The reason is attributed to psychosocial issues. I already, in fact, one of the point mentioned was already I have children, they are grown up and other responsibilities. Why bother about this? It is actually wrong. These are the certain other related things which actually interfere with her sexual responsiveness than anything. She is highly responsive. All through the life she can participate, and this is one of the best period as far as sexuality is concerned.
No, as far as the menopause is concerned, again, as I said, it goes case-based, First of all, whether she is staying with the joint family. Unfortunately, we think that adult people, they are asexual. Have you ever thought that your parents were sexual? Because sex in our mind is with the external beauty and youth. So they are being left sometimes in a city like Bombay in a drawing room with the grandchildren. So leave aside sex, they do not have a privacy to touch each other. Second is, at that time, the fear of pregnancy is gone. But at the same time, they think they become religious because there are so many babas over here. So she becomes, now the monk's mind comes into the mind. While the man wants to have sex till the end of his life too. The third is whether the partner is there or not. Many people have got a kidney problem, heart problem, bypass surgery, arthritis, lack of, cancer surgeries, gone through radiations, gone through the chemotherapy. All those things we have to keep it in the mind. And one golden sentence I would say, sex has no expiry date. I have given more than 10 lectures on it. Sex should be continued till if you are able to see, if you are able to walk some, and sex does not an intercourse. It means much more things over there. Sex toys are available, those who are alone, and those who does not have a partner. And last but not least, it's not a menopause, but no pause. So one till the last breath, even touching each other, looking at each other lovingly, holding each other's hand, it can also give them what experience they have of the orgasm, the same thing over here. So I would say this, and here I would like to share one of the things, that I was in Institute of Advanced Studies in Human Sexuality at San Francisco. So one day on a geriatric sexuality, there was a discussion and they showed us a video. And before showing the video, man was 84 years. And as far as the female is concerned, she was around 80 years. And what happened that whichever, small city, they have decided that they will videograph this thing. He went there and that day she had a very bad, some chronic illness and she had some exacerbation and she could not come. Then whole expenses were going away. Then now they said what to do. Then this gentleman said, I have my girlfriend. He was my classmate. She's staying in the same, city. Can I phone her up? And he phoned her up and he said, for this educational purpose we want. And said, okay, I will come down. And she came and they made a video. So this is a sexuality. On other side, it is the extreme what we are doing over here. So we are between, sex is no one thing which is normal. It has many colors. And there are between black and white, many gray colors are there.
In fact, as far as West and East, the differences, what Dr. Raj Brahma was mentioning, I still remember a villager who had difficulty in sexual performance and wife's demand, and he was somewhere around 50 plus. He says, I have erectile dysfunction. How you came to know this? In fact, his explanation was this. He went to one of his classmate also stays in the same village. He went and told her, my wife is making so much of fuss and I am not able to perform. He says, she agreed, try it me, and if it works, it is fine. He was not able to perform there. So it's not necessarily in San Francisco. Even in Indian context also, so many such things are actually happening.
During my college days, in the second MBBS or third MBBS, Dr. S.S. Thakur was there. And Madam Varchand, she was, after the hysterectomy, she was taking sutures. So he said, have you reconstructed the vagina? He said, she's 55 now, she does not need it, He said, no, but her husband may require her up to 80 and 90. Now, this is one message to all the gynecologists, that sex is a very important aspect of the quality of life, well-being of life, self-life. So it should be given a more important. And I would say any person whether they come before the marriage, adolescence period, before marriage, for other things, or for pregnancy, or for a infertility case, or in a menopause, or after operation. Please put one question on itinerary to ask about how is your sex life. Do you mind if I ask you some question? And if there is any problem, you can always talk to me.
Yes. Yes, Dr. Vedi.
Whether, as I said, doing homework, multitasking.
It was totally very nice session today. Yes, Dr. Vedi.
So,
And-
sir, I think so. We have a very elaborative discussion on female sexual disorder today with our the greatest speakers of India, I should say, Dr. Rajshekhar Brahmabhat sir and Dr. T.S.S. Rao sir. So I would just like to sum up this topic with a small quote on sex, which says that sexuality is one of the biggest parts of who we are. So that sums up the whole story of sexual life. I think so. I now hand over to Madan sir to sum up the session.
I would like to say a 3 mantra.
Sir.
Sex, first is R, is for reproduction. Second R for recreation. And third R is for a relationship. So Dr. Rao and myself has come to send a message that the sex is the most beautiful thing on this earth. If it would not have been there, neither you, nor he, or nor Satya, nor I would have been there. So let's not look at it as a taboo. And as I have gone through in 1985 exhibition Erotica, I have said that sex we have taken in our paintings, sex we have taken in our sculptures, sex we have taken into dance and music, sex we have taken into literature, and sex we have taken into the temples of Khajuraho. And let's not look sex as a taboo or dirty thing. It's a pulsation of life, and I think we should embrace it. That's all I would like to say.
Yes.
Before I give concluding remarks, is there any questions anybody has asked actually?
And last word, I forgot to say, sex is samabhoga. Both the partners should be able to enjoy. There should be no coercion, no force. And if we can do, I think you will be on a different heights in the life.
Yes. Thank you, sir.
Any questions? Any one or two questions?
So there are no questions in the screen, sir.
I think
But you had been so elaborative, sir. You both had been so elaborative. So I think there should be no queries about sex in any thoughts.
I think both of you, you and our Madan, both of you have brought out a very good question. I think you got the best out of Dr. Rao and me. And when Rao was there, I was very comfortable.
We were comfortable having both of you.
Both of you had been so very open on it.
Let me tell you, his institution is the only institution where you get a diploma and fellowship in the all over India. What I have given him a torch and he has taken to a different height. And every day when I think of him, I'm proud of him. So I don't say my Manas Putra like that. and right now, how many? 120, 130 people have already got the things,
Around 200. And this particular batch, we are inaugurating it on 2nd of July. We are having around 60 plus students.
Yes, sir.
It was a 2-floor building. A very small, first, more than 25, 30 years back, we started once a week, clinic over there. And today, you can see what they have done and how many bedded hospital, total hospital of, JSS.
JSS Academy of Higher Education Research, 1,650 bedded. But this is the biggest single roof hospital in the whole of Southeast Asia. And they have invested, my guesswork is roughly around 800 crores for that. And we used to work in very shabby places earlier, but now it almost looks like an airport. A lot of changes.
Yeah. Okay. Thank you. Shall we conclude the session now?
We are very happy.
Yeah, we are so happy. And
out this particular topic, and you did a really good homework. I would congratulate to both of you. and you were one by one, like a, Surya on one side, and the other side was, our first batsman. What is his name? Our captain. I forgot the name today.
I'm Sergeant Commander Vedahi.
There is
Yes.
In fact, this type of discussion, even a very small aspect, say for example, vaginismus or maybe pain penetration disorder. Or,
I think we can have a separate, different
separate.
discussion on
Very,
this.
very elaborate. Otherwise, now what we have done is very general way of putting things in so many aspects.
Yeah.
Very focused discussion was also possible.
It was a bird's eye view, I would say.
Yes. We will cover the details in next coming sessions.
So
Okay.
just like you, sir, we would definitely like to have many more sessions on sexuality.
Let us move to the vote of thanks. On behalf of AMOGS Sexual Medicine Committee, myself and Dr. Vedahi want to extend our sincere thanks to our AMOGS office bearers, President, Secretary, and all the executive members, and especially the Chief Guest, Dr. P.C. Mahapatra, sir, and the guest of honors, Dr. Bhaskar Pal, sir, Dr. Meenu, madam, Sneha, madam, Preeti, madam, and Dr. Amit Brundare, sir, and the main, our esteemed faculties, Dr. Rajshekar Brahmbhatt, sir, and Dr. T.S.S. Rao, sir. Thank you so much from our bottom of heart for elaborating this topic and highlighting so much in details, and it was very comprehensive and wonderful. We like it, and thank you so much once again for accepting our invitation and then coming in this webinar to guide all our delegates. Yes, thank you, Dr. Vedahi.
So thank you, sir. You have been the greatest.
Well, and we are also really grateful for the wonderful opportunity you people have provided to us.
Where do you work in the... He said, Ashwini?
Sir, Ashwini.
No, I had given an exam in Ashwini.
Okay, sir.
Research. I was on Vikrant even. So I was great that you were there from Navy. I felt so good.
Sir.
Nice to see you. It's a beautiful place over there. And your
Yes,
club.
sir. Please do come, sir, anytime. Sir, which part of Mumbai, sir, you're practicing?
I'm in a Jew scheme. My simple address is between Hema Malini and Dharmendra.
Sir. So that... Sir.
Okay, thank you. Shall we end the meeting today?
Oh, yes.
Yeah. Good night, all.
Good night, sir.
Thank you.
Good night, Rao, sir. Good night, Brahmabhat, sir.
Night, sweet dreams.
Thank you so much, Madan, sir, for giving the opportunity and
thank you.
making this show a hit show, sir. Thank you, sir.
Yeah, I will share the link of YouTube tomorrow.
Yes, sir. Yes.
Right now, I will share. There is link. Yeah, thank you.
Thank you, sir. Thank you so much. Good night, sir.